Congratulations. If you are looking at Module 4 Cancer, you completed Quiz 7 and you are on your way to Quiz number 8 to finish the semester. This is something that I mention quite frequently, that all of us are going to die at some point, so please be prepared. Everyone's going to die. So, what is the second leading killer of all Americans? Is it accidents, cancer, cardiovascular disease, or your feelings about how stress affects you? I am a doctor, but I'm a fake doctor. This is about health and medical concerns, which I am not a medical doctor, an MD or an OD, doctor of osteopathy. So, we're going to talk about cancer. Module 4 is about SLO2. Explain the influence of personal behaviors, responsibilities on developing, treating, and preventing hypokinetic diseases, infectious diseases, stress we talked about in Module 3, and addiction. So last time we were talking about diabetes and the different types of diabetes and what they mean, the consequences that happen, the health concerns, and ways of preventing or treating those. So we're going to look at compare and contrast the difference between tumors and cancer, even though one of the videos you will see, they kind of use them synonymously, though officially they are separate and different terms. Look at different types of cancer, what causes cancer, and about how early detection is critically important. So cancer is an abnormal, uncontrolled multiplication of cells, which, if left untreated, can ultimately cause death, which is different than a tumor. It is the second leading cause of death in the US after heart disease, cardiovascular disease, coronary artery disease, whatever you want to call that, and 1 in 4 deaths in the US is caused by cancer. So, an overly simplistic look at the human body. Cells are the building block, and then you get similar types of cells together, and you create tissues, you get organs, which are made up of different types of tissues. I have some listed that are there, and then systems are groups of organs that work together. Like you have a cardiovascular system, which is the heart, blood, and blood vessels. You have the muscular system, which is not only made up of muscles, there's neurons in there, there's connective tissues, etc. So cancer attacks at the cellular level, which is going to impact tissues, organs, and systems if it goes untreated. Which of the components of physical literacy is based on your ability to move well? Is it confidence, motivation, motor competence, or the knowledge and understanding of the benefits of physical activity? Motor competence. So, what causes cancer? There are a number of reasons for that. Again, every disease has multiple factors. You cannot necessarily just nail it down to one cause. So there's a hereditary predisposition, as we're going to find. UV radiation, so being out in the sun unprotected. The different chemicals in the environment, like the one we saw on endocrine changing chemicals. Viruses can cause that. Smoking, obviously, is one of those. And then the cells dividing where they don't replicate correctly. All of those can cause cancer. So this is a video that's on D2L. If I were you, I would watch it. And even though they spell it Tumour, it's still the same word. We just don't have the U. And this gentleman does have an English accent. He talks about the difference between a tumor, which is not malignant and it grows, and the difference is it doesn't spread. Here's a definition from Sport Australia of physical literacy about developing the skills, knowledge, and behaviors that give us the confidence and motivation to lead active lives. And the 4 components are confidence, knowledge and understanding the benefits of physical activity, motivation, and motor competence. There are the standards, which you will see on the final exam. So when it comes to cancer, there are certain things that you can do to lower the risk. So if you avoid tobacco, you significantly decrease the risk of chemicals, and that includes vaping and e-cigarettes. Your dietary choices, we're going to find out the significance of that. Being obese and overweight, a sedentary lifestyle, exercise and physical activity decrease the risk, and sleep, because that impacts your hormones, melatonin, and prostate cancer, is a concern for males. Uncontrollable factors, your race, ethnicity, and poverty, carcinogens in the environment, and the role of DNA. So your genes are the bullet, of the environment, and your lifestyle are the gun, which means that it doesn't have to fire that hereditary bullet, so to speak. So if you look at this, throughout the course I have mentioned how my father had prostate cancer before 60 and my mother had breast cancer before 60, so I kind of made it seem like, oh, I'm inevitable for a cancer victim. But look at this, it's only 5 to 10% is based on genes. Your environment, so your lifestyle. Diet is 30 to 35%. You're thinking, oh, whoa, wait, weed, you just said that tobacco is the most preventable. That's true. Remember, for the US, about 1 in 5 adults smoke. So even though it's only 20% of the population, it's still 25 to 30%. Everyone eats food and drinks beverages. That's why this is the number one. Because 80% of the people don't use this and don't have that risk. 100% of the people have this. Infections, obesity, others, whatever that is, and then alcohol increases the risk of throat cancer. So prevention, I'm all about prevention. Know your family history, get regular checkups. For males, that is testicular self-exams. For women, that is breast self-exams. And then the different exams. Males, after 50, you get a prostate exam, sometimes in the 40s. And women, you have your regular gynecological checkups. Self-exams. Anti-angiogenic chemicals. There's a video that I would love for you to watch talking about anti-angiogenesis. The antioxidants that are in fruits and vegetables, cruciferous vegetables, vitamin D, physical activity, exercise, and then your sun exposure awareness. So here are the different cases, cancer cases, and then how many deaths. So just about every part of your body, as you see here, can get some sort of cancer. For women, breast cancer is the most prevalent, and it's also the number one killer. For men, prostate is the most prevalent, and it is the number 3 killer behind lung cancer, colon and rectum, prostate. Women, by far, it is breast cancer is number 3, 2, lung cancer number 1, breast cancer, colorectal. So they are huge. Going back to that, you want to have self-monitor, get regular checkups, medical checkups, etc. Be aware of your risk factors, report any changes, which we'll talk about. The treatments that you can use, surgery. My mother, who had breast cancer, she had a double mastectomy where they removed both breasts. There's chemotherapy, which helps to destroy that. There's radiation. There's some other chemicals that are out there that you'll hear about. You want to build your immune system. There's emerging treatments, always trying to find new ways. So the ABCDEs of skincare. Number 1 is asymmetry. So if you have some sort of mole or birthmark that's not symmetrical, that could be a concern. The border is rough like that. The color changes. Dimensions greater than 6 millimeters, and if it is growing or evolving, all of those are risks. In terms of the stages of cancer, stage 0 is that it has been caught and it's in the same space. Stage 1, it is growing. Stage 2, it has not spread but grown more. Stage 3, it has spread to the lymph nodes and surrounding tissues. So when you're sick and your mother or father feel in your neck, those are part of your lymphatic system. And then stage 4 is when it has metastasized and spread. Usually it is discovered in the lungs because all blood returns to the lungs. Here's an excellent video. This guy is a medical doctor. He's talking about how you can eat to prevent cancer using anti-angiogenic. It's on D2L. Also talks about how that could help with maintaining healthy set points for weight. This, it says caution, 7 warning signs. You can't see the very top of this. This is a question on the final exam, and there's going to be 14 possible answers. To C, to A, to U, to T, to I, to O, and to N. So the C is change in bowel or bladder habits. A is a sore that does not heal a normal amount of time. U, unusual bleeding or discharge. T, thickening of breast tissue or a lump. I, indigestion. O, obvious changes to mole or warts. And N is nagging coughs. Remember, I did not mention this. Men, you can get breast cancer because you are a mammal. Women cannot get prostate cancer because they don't have a prostate. So here are the two references I use for physical literacy. So what can we take away from the concern about cancer, the information about cancer? Take some time, pause the video, and think about that, what's important to you, how you can live a better life with your loved ones around you as well. And then compare and contrast the similarities and differences between tumors and cancer. Recognize and differentiate the different types of cancers. Explain the known cause of cancer and how it develops, and examine how early detection is critical to effective cancer care and treatments. As always, if you have questions, please email me. Check the syllabus for student hours. Set up a WebEx. Stop by my office, whatever that is. Good luck. Minimize your risk of cancer by being active, having a healthy diet, and those other practices that were mentioned.